histological findings characteristic of cirrhosis, which we illustrated at the beginning of the chapter. Remember, all the organs that we discussed earlier, including the skin, heart, joints, and testes, will show these same deposits of hemosiderin as the disease progresses. It's the liver, however, that usually sees the most severe iron deposition. The treatment for hereditary hemochromatosis is pretty old school. Just make the patient bleed. A lot, in fact. Often up to a unit every week. This is a less fancy way of describing phlebotomy, of course. Deferoxamine, an iron chelator, can also be used to bring down iron levels. Just think of this grabby sandbox toy, latching onto iron in circulation. The name deferoxamine is pretty straightforward. Just think of ferro as an iron. So deferro is getting rid of iron. Treatment is monitored by checking ferritin levels. Before we move on, I want to briefly mention hemosiderosis, aka secondary hemochromatosis. Patients who receive frequent transfusions, such as those with chronic anemia caused by sickle cell anemia or thalassemia major, are at risk for hemosiderosis because they get extra iron with each unit of blood. Pathologies that cause ineffective erythropoiesis can also cause iron overload. Patients with beta thalassemia, for example, have problems with hemoglobin production. Heme has a hard time making it into the globin, and iron builds up in the body instead. Imagine this collapsing set of weights as a complex of hemoglobins. Just not assembled correctly. People who abuse alcohol can also become iron overloaded because alcohol increases intestinal iron absorption. Note that for this to happen, they actually have to maintain their nutrition and eat iron-containing foods. That's why anemia, rather than iron overload, is more commonly seen in malignant alcoholics. All right, on to Wilson disease. It's time to hit the rings. Wilson disease, or hepatolenticular degeneration, is an autosomal recessive disorder of copper overload. Notice the copper penny theme we're developing here, as well as our usual shy recessive kid cowering off to the side. Due to an autosomal recessive gene mutation in hepatocyte copper-transporting ATPase, abbreviated ATP7B, hepatocytes cannot transport copper into bile for excretion. At Sketchy, a vending machine powered by 3P batteries is a recurring symbol for ATPase. We even made it a kinda biliary green color, since the liver is having trouble loading copper into bile. In addition, copper is unable to find ceruloplasmin, the protein that normally carries copper in the blood. In fact, in patients with Wilson disease, serum ceruloplasmin levels are low, as depicted by the lowered cerulean blue swim trunks. In a public restroom, I usually pull off a cautious hover maneuver or a quick pull-up pant leg side snipe. I don't know why it's full-on Donald Ducking it in there. Anyways, since copper can neither leave the body as a component of bile nor bind to its regular transporter protein, it floats around in free form, occasionally binding to albumin, but mostly depositing in tissues throughout the body. Bad copper. One of the classic signs in patients with Wilson disease can be found in the eyes. Kaiser-Fleischer rings are copper-colored rings encircling the periphery of the iris. On slit lamp exam, or in severe cases, just by looking at the eyes of a patient with advanced disease. They're caused by copper depositing in the decimate membrane of the cornea, and about 70% of patients with Wilson disease will have Kaiser-Fleischer rings on exam. Remember, we're having trouble loading copper into bile here, so copper is accumulating in hepatocytes. Free radicals are formed, depicted yet again with a shower of oxidizing sparks, leading to cellular damage and messed up metalloproteinases. About half of all patients with Wilson disease have hepatosplenomegaly and liver fibrosis. Unlike most other causes of liver cirrhosis, however, hepatocellular carcinoma is rare. The excess copper floating around in the circulation can cause hemolytic anemia, with a significant proportion of patients presenting with jaundice. Copper can deposit in different parts of the brain as well, leading to neurologic and psychiatric symptoms. The most common neurological symptom is dysarthria, which can include erratic speech and volume pattern. Deposits in the putamen can cause Parkinsonian symptoms. We usually represent the cogwheel rigidity of Parkinson's with, well, a cogwheel, like this one. The neuromuscular manifestations of Wilson disease are numerous, in fact. Patients can present with dystonia, tremors, and even choreoathetosis. which can involve sudden jolting movements of a limb, also called hemiballismus. It's worth a YouTube search if you've never seen it before. And lastly, copper deposits in the primary cerebral cortex can cause dementia even. Let's talk about labs for a second. You might be surprised to know that you'll often see low serum copper levels in Wilson disease. What? I thought we were in a state of copper overload. Well, remember that ceruloplasmin levels are low too, represented by those lowered cerulean blue shorts. Ceruloplasmin is the preferred carrier of copper in the circulation, so with less copper transporters in the blood, overall serum copper is low. To remind you of decreased total serum copper, we've drawn in a flyer for getting serious about fitness at Total Gym. That word serious should remind you of total serum copper. We can look at free copper in the serum, however. This is the copper not bound to ceruloplasmin, and this value will be elevated. Along with elevated free serum copper, look for elevated urine copper levels as well. Both can be used to diagnose Wilson disease. Geez, what happened in there? Ugh, gross. See, this is why whenever I go to the beach, I just use the bathroom nature intended. The ocean. Just fire off a torpedo or two. Treatment for Wilson disease is a copper chelator called penicillamine, which can inhibit copper reabsorption in the intestines. A newer, lesser used chelator is ammonium tetrathiomolybdate, a mouthful that binds to copper and allows it to be excreted via the bile. Again, for chelator therapy, just think of another one of those grabby crane sand toys. Penicillamine specifically is depicted by a recurring penicillamine pencil. All right, let's recap. See that shy recessive kid? Hemochromatosis is caused by an autosomal recessive mutation of the HFE gene on chromosome 6 that causes too much iron absorption from the gut, hence the iron weight pressing into his gut over there. All that iron coming in leads to increased serum iron and ferritin, the storage form of iron. Transferrin saturation will also be high, as depicted by the overloaded barbell. But the body tries to compensate by turning down the overall level of transferrin, and therefore the total iron binding capacity, which will be low. Take note of those discarded transferrin bars on the ground. In any case, this results in sandy-colored hemosiderin deposits in various tissues. If needed, you can use Prussian blue staining to see iron on liver biopsy. Hemochromatosis is most common in older men and has delayed onset in women due to iron loss from menstruation, waiting to rear its ugly head during menopause. Remembering the manifestations is easy when considering the various tissues. Bronze diabetes and malabsorption from pancreatic damage, restrictive or dilated cardiomyopathy from cardiomyocyte deposition, hypogonadism from the pituitary, and polyarthritis from, well, the joints. Wilson disease, on the right, results in impaired excretion of copper and is inherited in an autosomal recessive manner. It's caused by a mutation in the ATP7B ATPase, which results in deposition of copper throughout the body, leading to Kaiser-Fleischer rings, painful hepatomegaly, hemolytic anemia, and neurologic features such as dysarthria and Parkinsonism. See that crumpled Total Gym flyer? Look for low total serum copper due to low ceruloplasmin, but really high free copper in the urine and serum. Just like in hemochromatosis, you can lower copper levels by chelating it, in this case with penicillamine. Man, that was a good workout. Time to head over to our next sketch and rinse down all that testosterone and rock-hard man boob with a couple of brewskis. Whoa, slow down there, buddy. Everything in moderation. Believe me.